Hi, I'm Dr. Adriana Karpati, and today's topic is how do you know when you need a new orthotic? It's a really good question. How do you know? I can tell you that a new orthotic will last you and give you about a year to year and a half of true life. And what I mean by that is that when you have an orthotic that's new, the foundation of the orthotic itself, and they're all made out of different materials, but most of them are made out of this polypropylene plastic, which gives a little bit of flexibility but still has really good control. An orthotic gets old the more that you stand on it, and you can imagine after about 6 months of standing on one of these that the plastic will start to slowly fatigue. Now, will it fatigue enough to where you don't get the support you need? Not at all. It will last you quite a while, but after about a year to a year and a half, that plastic starts to fatigue more, and it's not giving you the best foundation. And I always talk about the best foundation for your foot with an orthotic. Truly, it depends also on how much you weigh, the type of activities that you do. Are you in an occupation where you lift a lot of heavy boxes? A lot of that can also affect the life of an orthotic. How do you know you need a new one? Well, say you have your orthotic, you've been very happy with it, and you start getting those aches and pains that you used to have before you got the orthotic, or not as bad, but maybe you feel something like that coming back and really nothing's changed in your life. That's a sign that you need a new orthotic. Other signs are that you notice the orthotic is not as in good of a shape as it could be. And I'm going to show you an old one. This is an example of a really old orthotic, and I'm going to kind of show you an up close. It's torn apart. It's really compressed. You can almost see the change in the color of the post or the stabilizer of the orthotic here. That rubber is really compressed. So is the padding on the top. It's almost got the delve of all where the toes are, and it's really kind of squashed it down so that it's not giving you that comfort that you're looking for. That's another really good sign. And last, I think, is really also you're just looking at your shoe. If you have an orthotic in your shoe and you've been wearing it and things are doing well, but you feel again that you might be getting some aches and pains, just take your shoe off and look at the bottom of your shoe. Look at the treads. Are they even? Like you would the tires of your car. If all the treads are really worn out, that's a really good sign that you need an orthotic. If you look at the back of the shoe and the rubber is really compressed, and I can try and do that, but you get my idea. If it's really kind of, again, I like to use that word squished. If it's squished or squashed down here on the side, that's a really good sign that you need a new orthotic. Or if you watch, and you'll look around at people and you'll see the way they walk, and sometimes they walk really on the outside or on the inside, and you kind of tilt your head and you think, wow, they could do it with a new shoe. That's probably a good sign too, that it might not just be the shoe. I would replace the shoe first and see if that makes a difference on your symptoms. And if it doesn't, it's a sign that you need a new orthotic.